Yes, I'm Chris St. Charles. I'm what you would call a otolaryngologist, head and neck surgeon. In reality, everyone else calls it ear, nose, and throat doctor. So these kids that we see are mainly having swallowing or breathing issues. So we usually have a pulmonologist and a gastroenterologist and myself examine these kids together with the speech-language pathologist. My role in it is to really assess the airway, specifically the upper part of the airway or the voice box or larynx. We do check for other things. We do check for adenoids and tonsils and ear issues and hearing, but the main focus of this clinic is swallowing and breathing issues. Everyone involved in the team has years and years of experience of dealing with kids. So hopefully it will not be a scary experience. Hopefully it'll be one where you'll get your questions answered. I think one of the great things about the clinic is you see everybody at one time. In the old days, you would have to go and see the GI doctor, and then you'd see the speech-language pathologist, then the lung specialist, then you'll come to my office. Maybe 3 or 4 different locations spread out over 3 or 4 months. This way you'll come, you'll be checked in, you'll get a stay in one room, and we'll all come and see you. The communication, both in the room while you're there, is important. And I think hopefully you'll get your questions answered. But the communication we have after you leave, where we meet in a conference, and we go over all the information, all the things that we found during your visit, and we try to put a comprehensive plan together. That should be easy to do if we weren't in a multidisciplinary clinic, but quite honestly, communication is very difficult between 5 providers in our busy days. And that communication sometimes could take weeks or months to do. That's why we have a clinic coordinator, Jeanette, who's excellent. So she takes the input, and we all do notes, and luckily here at Erlanger we have Epic, so you can actually read the notes because it's electronic. And then Jeanette puts it together in a summary, and she sends it back to your primary care physician or the referring physician, so they'll know what we found and what we're thinking and what the plan is moving forward.